This tutorial will show you standard operations and options. This app is called the House DNA Robot, or House DR for short, version 7.26. There are essentially two screens, the main appointment page and the routing template page. Just press on the patient's name here and MAP will take you to the routing template. The main appointment page, or MAP screen, has an upper part and a lower part. The lower part has patient scheduling related fields to schedule an appointment and to list patient's information. Just touch the Schedule Appointment or Make Appointment button to open the Scheduler part. The lower part of the screen will expand and patient scheduler selections and fields are opened. To collapse or close the lower part, just click here on the red. Patient names may be entered by using the Patient Files button to display patient's information on the appointment book. Alternatively, patient names and information can be ported over from another external program and filed to this app. Now, let's go to the routing template. The routing template keeps track of the patient's last 4 diagnoses listed here on file. For our new patient, this field will be open or clear, since there will not be an existing diagnosis on file for a new patient. Evidently, this is an established patient, showing 4 diagnoses in the permanent diagnosis file. This page is like a worksheet. To create, change, and file another diagnosis, use this field here, Add to Permanent Diagnosis. The IMG button, or Image button, allows virtually any file to be quick orientation to this patient by looking at this picture here. It can be the patient's picture, clinical photos, op site of condition, labs, x-ray, or other documents inserted here. As you can see, the image can be expanded for closer inspection. Additional images can be placed in there. The images are taken from anything in your computer. There are 2 ways to enter CPT and to enter ICD. The button and the predictive text value box fields are used to enter numbers and descriptions. Here's the buttons, and here are the predictive text value boxes. To select a service to be reported, all you need to do is put in an in-house letter, and the CPT code and code description will appear. Or you can add in the code number if you know it. The other way is to click on the CPT button and simply select it from the categories. A diagnosis can be chosen from the button and added to the list, or the predictive text could be used. In this case, we're using an arbitrary diagnosis to demonstrate how diagnosis position number 4 will replace the permanent diagnosis existing in the field above. Press RTO for return to office. Make selections from the tabs. If an appointment has already been made, a pop-up alert will let you know that. Select a diagnosis. Let's preview what we've just done. Before sending this routing template of services and diagnoses listed to populate your external main program or medical software, touch this preview button here. We see that the new diagnosis has been listed in the permanent diagnosis field. It replaced the previously existing permanent diagnosis. We see the services that have been listed with the diagnoses that follow, and in the specific order given. Diagnosis 1 relates to this diagnosis, and diagnosis 4 relates to this diagnosis. We listed diagnosis 1 first in this case, and we listed diagnosis 4 second in this place. We see the return to office date and a surgery date. So everything looks fine. Let's close the preview, and we see that the information remains in the same positions before we previewed it. Okay, we can see that this information that was created on a routing template screen has been reviewed. You see how the diagnosis information was added and replaced here in the preview. You see that the goods and services and procedures are listed from the preview. You see that the ICD or diagnosis descriptions listed are in the precise order that we've determined to list them in, and in the order of importance. Each diagnosis will correspond to a certain CPT listed in the CPT DX field on the routing template. You see the surgery date, you see the return appointment, you see the short discussion or status note, reason for the person's return. Now, let's go back to the routing template page, which is here, and you see that this information remains on the worksheet. A preview looks fine. Before sending this information that was examined to the main medical program, everything's looking good, so let's now press STP. The STP button means send to post. This information showing from the routing template will then populate the external program. Send to post is right here. Now the information has been populated to the external program. Health level integration allows its compatibility and support integration. Migration and installation are achieved by optimal and optional configurations. The app serves as a standalone operation. It's that easy. Return visits and any other procedure or service dates ready for the staff when the patient goes back to the reception area or checkout area. Just press here on Make Appointment from RTO, and you'll see the date that we scheduled for this patient to return. Professional staff no longer needs to rely on the patients to recall when their return date is for, or the reason for their office visit on their return. There is no miscommunication by the time the patient goes to set the next appointment. Patient's names remains in this field until the appointment I made, and alert will display if it's left too long. Settings allow this configuration for these special alerts. For example, when a return office date was made but the staff overlooked the procedure, the program will leave a display and the name here. The patient appointment card or pack can be printed. Professional administrative Never need not jot down and return dates on scratch pieces of paper. The patient appointment card is printed and it's given to the patient. PAC conveniently displays all the patient's return times, dates, and providers' information. The appointment book displays the abbreviated discussion or status for the nature of the patient's return visit. These are synchronized operations, part of our program and apps. The app book displays its status. MAP has a separate send to post function, since some healthcare providers will prefer to make configurations and settings using their existing medical software. Patient Scheduler, instead of our in-house DR Patient Scheduler, may be used by your own medical program instead of the one here in this app. A very special applet option allows providers to communicate with patients from our appointment book. This is located here in the Contact section. Configuration is made in Settings to select options. To call now, you just click here and it will call the patient right from the appointment book. If you click here, it will make an email and send it to the patient. This will become part of the contact options for provider staff to save time and maintain continuity of care. Just as with the return date and times, continuity of care makes less risk, saves money than missed communications and appointment blocks. This concludes our tutorial on general review of the House DR app program, version 7.26.